So this is a 50-year-old woman that comes in with recurrent chest pain over the last 3 years that's not related to exertion, and she states that she feels the food is getting stuck in her chest. A chest x-ray shows a widened mediastinum, and she's given a PPI, which is a proton pump inhibitor, but she has no relief. What is the best test to diagnose this? A. Esophageal pH monitoring. B. Esophageal motility study. C. Endoscopy with biopsy. D. Barium swallow study. So I'll let you answer this question, and then I'll explain in 5 seconds. Okay, so the answer is going to be B, esophageal motility study. So for this one, this patient has achalasia. So achalasia is a condition where you have the lower esophageal sphincter close and have very increased pressures, so greater than 45. Now, this is a problem because you need that to be relaxed in some cases to allow food to move through. And that's why you're having this clinical presentation of food getting stuck in the patient's esophagus, because the GE junction is just under so much pressure. And so the main treatment can be surgery, but if the patient does not want surgery, you can use other therapies such as botulinum or drugs like calcium channel blockers. The other answer choices include endoscopy, and that's mainly used for pseudo achalasia. And then barium study, you can use it for achalasia, and that's usually what you see in question stems with the dilated esophagus and the bird beak appearance. But the actual definitive confirmatory test is going to be esophageal motility study. This is just, it leads more probability to it being achalasia, but you want it to be confirmed using esophageal motility study. And then finally, we have the esophageal pH study, and this can be used for GERD since you have a weak, so essentially the opposite effect in GERD, because in this one, in achalasia, we have the GE junction being under too much pressure, and for GERD, we actually have a very low GE junction sphincter tone, and so that allows acid to reflux back up, and so therefore you can use the esophageal pH to measure that to see if it's more acidic than normal. On top of that, you wouldn't have the widened mediastinum, and then after she was given the PPI, it would at least help somewhat. And so with all those clues, they're pointing you towards B, because this patient has a diagnosis of achalasia. So I hope that helped, and thanks for watching.